Trust Board of Trustees to order. It's October 10th, 2023. It is 1 p.m. We're going to open with the call to public. Is there any public here? I don't see any. So I'm going to close the call to public. Number 2, discussion and consideration of and possible.
Chairman,
Yes.
I would like to make sure we have a quorum, so we can take a roll.
Okay. So we have anybody on the phone?
So we'll go through the list. Chairwoman Angus,
Here?
Dalton Barlow, Berlin Tinnell, Susie Perel-Duranzo. Susie, are you still there? I know we had her just a moment ago.
Do you want to wait?
Randy, can you verify if we have someone on the line? I'll come right back to her. Joy Bancroft? Here. Okay.
Okay. I believe we have a quorum. Is that okay? Okay. We have, we're just waiting to hear if Susie's on the line. Everyone's here except Dalton Barlow. So we have a quorum. Okay. Thank you. Are we going to wait or do you want me to continue?
I believe we can continue. Randy, can I get a thumbs up? Do you know if she's on the line?
Oh.
Okay. 6 on the line? All right.
Okay. 1 second. I'm going to text her and see if she's on the line. All right, well, we'll proceed and hopefully we'll be hearing her voice in the near future. All right, number 2, discussion, consideration of and possible action regarding approval of the March 9th, 2023 and March 28th, 2023 meeting minutes. Discussion?
Madam Chair, I have a couple of comments on the minutes that I'd like to suggest that they be addressed and revised as we approve the minutes. There are 2. First one being, and they're not really critical either way, but I think it's good for record keeping. In listing the members of the board, we identify Ms. Susie Perel-Duranzo as the member, the full name. And then in the minute, we refer to her in some locations as Perel, some locations as Duranzo, and it's really not consistent. So I think just for consistency and record-keeping purposes, it would be great to keep with what she's identified as Susie Perel-Duranzo. That's one comment. But it goes through the minute, and it would be great to fix it. The other deals with on page 6 in tab 2, that is reflecting the minutes. Section 2 on page 6, it says Mr. Collins gave explained that this item was presented, and I'm thinking it should probably just say, drop the word gave and say, Mr. Collins explained that this item was presented and so on, or just gave an explanation and fix it that way. Other than that, Madam Chair, I move that we approve the minutes as is, unless there are any other comments from the board members.
You have a comment?
Oh, I just wanted to advise the clerk of the board is the one who types up the minutes for this, and then we review. So I'll advise her as such also.
Okay. Very good. Okay, we have a motion. Do we have further discussion?
Chris Marshall
is now joining.
Oh, is that?
Susie, are you on the line?
Yes, I am on the line. I'm
Okay, welcome.
Am I connected? Hello? Hello?
Susie?
Yes, I'm on the line. Can you hear me?
Okay, very good. Okay. We're on
Thank
number
you.
2 of the official business. Okay.
I also have a comment on the March 28th minutes, although I wasn't here, so I won't be voting on that. But on page 7, where it addresses, Amanda gave an overview in item number 7. Nowhere I didn't see, and I may have missed it, where we identify who Amanda is or last name or what
Oh,
company
okay.
she's with.
So we need some more clarity about her position in the minutes?
Yes, we know who she is, but 3 years from now, people may not.
Exactly. Okay, good comments. Anyone else?
Yes.
All right. We have a motion to approve the minutes. Do I have a second?
Second,
Sorry.
second.
That's okay.
Due to the records, I would recommend to have the minutes amended, to have an input from the members, and then we'll
Okay,
approve
so
it
the
next
motion
time.
would be to approve with amendments as discussed.
That's fine too.
Okay, you want to say that? Retract your original?
Madam Chair, I will retract my original motion and move to approve the minutes as revised, to be included in the approval. Thank you.
And I need a second, and we have a second. I think Susie seconded that. Okay, we have a motion second. All in favor? Aye.
Aye.
Opposed? Motion carries. Number 3, discussion, consideration of, and possible action regarding Navitas contract. And so this is one that we're going to go into executive session. And so I need a motion.
So moved.
Okay, we got a motion and second. All in favor?
Aye.
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 Okay, so now what is the process, since we can block out everything, but Susie can still be there?
Can I still be here?
You better be here.
Hello? I bet. Or do I need to redial?
I'm not sure. We're finding out.
Okay. Hello? 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 Hello?
Hi, I'm Chris Marshall with Buck. I'm waiting too. So I guess whatever, if they went executive session, I guess the phone got cut off. So,
Yeah.
so
Are you still there?
I'm still here. Yeah.
Okay.
Yeah, I don't hear them. So I think they're just in the executive session. So
Yeah, and this is Rick with Meritain, same thing. We're basically shut out because they're
Cut
in
off.
executive session.
Yeah. Okay, that's fine. That's fine. I thought they were going to
Navitas
connect me.
Fund
'cause I'm-
too, same.
Yeah. I thought they were going to connect me because I'm one of the trustees, but I don't know. Probably not.
Yeah, I would think you should be there, so they're probably trying to figure out how to get you in.
Yeah. Where am I? Okay.
Yeah.
Hello? Susie Duranzo.
Is now exiting.
Marina Water.
Is now joining.
Hello? Susie Duranzo.
Is now joining.
Hello? Hello?
I think they're in
Yeah.
executive session. I
Oh,
think
they're
in
still?
executive. Yeah, I think so.
Yeah, they're still in executive session. And I thought, Susie, I thought you dropped so that you could join whatever they were on in the executive session. I didn't know if it was a different number.
Susie Dorenso.
is now exiting.
Okay. We'll wait until we get her back on the line. Susie, are you there?
It sounded like she just dropped off, like just right before you guys came back on.
Yeah.
Who's that?
Susie, are you back on the line yet?
Yes, I'm back.
Oh, okay.
I'm back.
All right. So I need a motion for agenda item
Unknown
3.
participant is now joining.
Madam Chair,
Yes.
I move to confirm award of the Navitas contract effective July 1, 2023, as previously awarded.
I need a second. Second. Okay, I got a motion and a second. All in favor? Aye.
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 Opposed?
Aye.
Okay. Oh, so wait, do we have Dalton Barlow on the phone now?
That's what I was just asked. Dalton, are you on the line?
Yes, I am.
Oh, okay.
Fantastic.
Well, welcome. All right, so we apparently have to go into executive session again for this next item. And how are we going to do that now?
Dalton, this is Leanne. Do you mind if I call you on your cell phone?
And I'll
That would be just fine.
Stephanie Hemmerling?
Is now
Perfect.
exiting.
Oh, that might have been Susie. Susie, are you still on the line?
Yeah, no, yes. Yeah,
Okay.
I'm here. So you want me to hang up here and you're going to call me on the other line, right?
Yes, please. Supervisor Ingus is going to call you from her line, so that way we
Yeah.
Okay.
have
We have
multiple
two.
available.
All right, thanks.
Okay,
Bye.
all right.
Yes, and the
Motion-
person that dropped was from Navitas. That was Stephanie Hemmerling. This is Lisa Thompson. I'll drop as
Susie
well because I think you
Dorenso.
voted on the Navitas item.
Is now exiting.
Okay, does everyone get that?
Okay, thank you.
We're all going in the room. 2 people are going to call. I need a motion to go into executive session for
Lisa
item number
Thompson?
4.
Is now exiting.
Second. All in favor? Let's
Is
go.
now exiting.
This is the only other item that needs to
I need a motion to leave executive session.
So moved.
All in favor?
Aye.
Okay, so I'm going to wait to make sure that we have two people on the line.
I'm here, Susie.
Yay. Mr. Barlow?
Yes, I'm here.
Oh, very good. Okay, so I need a motion for item 4.
Madam Chair, I would move to approve the award to CureLink for a 1-year term effective January 1st, 2024, with a maximum of 4 additional 1-year renewals, subject to successful negotiation of an agreement for the Employee Assistance Benefits Service, and also move to authorize Ken Cunningham to sign the agreement on behalf of the trust.
I need a second.
Second.
Motion and second. All in favor?
Aye.
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 Opposed?
Aye.
Opposed? Motion carries. Thank you very much. All right, number 5, I have to go back here. We have the wellness program update.
Hello, my name's Tori Hudson, and I've stepped into Missy's role as the Senior Wellbeing Consultant. So I'm excited to be here, and over the last 5 weeks, she's been catching me up to speed on everything that's been going on. So excited to provide you with an update. A few screenings have taken place as preventative measures to catch different abnormalities in their early stages. The first screening was the HRA, Health Risk Assessment, which addresses risk factors for conditions like high blood pressure and diabetes. Participation for this screening has continued to increase over the last few years, which is great to see. The second screening that took place was the skin cancer screening. Compared to last year, we did see a noticeable increase in the amount of abnormalities noted. Last year was 21%. This year is 42%. I am working with a vendor to figure out what the cause of this may be, but regardless of the reason, these employees now have the opportunity to address these abnormalities in their early stages. The last screening that took place was the cardiac and organ screening. This one addresses risk factors and abnormalities in the carotid artery, the thyroid, the liver, the gallbladder, and more. We usually see the thyroid present as the highest abnormality. In this last screening, 42% of employees screened presented with some kind of abnormality recommended for follow-up. So again, thanks to this screening, they have the opportunity to address it in its early stages. Employees also have different wellness programs available to them depending on what their specific needs are. Livongo is our program to support those with diabetes, prediabetes, and weight management. I was very excited to see that unique members enrolled in Livongo have more than doubled since last year. So there's now 217 unique users enrolled in the program, which is very great to see. Hinge Health is our program that supports muscle and joint issues through delivered exercise therapy. Currently, there are 37 users enrolled in the chronic program and 2 enrolled in the acute program. And last but not least is Navigate, which is our newest wellness program. You can think of Navigate as a centralized hub where employees can find all of the wellness resources available to them in one place, including Hinge and Livongo. Navigate itself also offers employees resources to different programs like online education, physical activity challenges, preventative care, and more. Members who participate in these programs can receive points. Currently, there are 62 users enrolled in the program, and the well-being survey is our top engagement activity. Because Navigate is our newest program offering, I am working closely with Navigate and with the Wellness Committee to continue to grow engagement in this platform. We have plans to develop a tailored weekly marketing campaign and offer users other marketing collateral like webinar demos showing them how to make the most use of the platform and all of the resources available to them through that. And I will also be promoting Navigate at the upcoming Wellness Fair in November. And that's everything that's been going on in the wellness program. Happy to answer any questions. Thank you for your time.
Any questions? I have a question for Mr. Elters. Do you think that perhaps doing a presentation at a Board of Supervisor meeting about Navigate would be a good thing, or should it be done?
Madam Chair, thank you. I honestly think if there is a drawback to any new program, would be the lack of awareness of it. And the fact that our board meetings are now streamed and our employees have access to attending, putting such an item on the agenda so they're aware that it's going to be presented, and then having the presentation could only help. And if it helps one person, it's worth it. So we can work on.
Yeah, maybe a
such
presentation about the whole wellness program. It's because there's still other things that have kind of a low, like the Hinge, which is very good. I don't think people really understand that either. So maybe it's time to do that.
Absolutely, and we can target the appropriate board meeting one with fewer agenda items and place it on the
Please.
agenda. So sure, absolutely, great idea.
Okay, great.
Great.
Thank you. This was
you.
just, oh, I'm sorry. Anything else?
No.
Okay, that's going to drive me crazy. All right, there's no action for that. Number 6, discussion of pre-audit financial information through June 30th, 2023 and 24 county budget. Thank you.
Good afternoon, Madam Chair and trustees. Just before I get started here, I just want to point out that the June 30th, 2023 numbers are all unaudited, so these are subject to change. So I'm looking at page 18 of the backup. You can see that our health trust fund cash flow, we are seeing a little bit of a decline there through through June. This, along with the health trust fund balance, in past years, the recommended actuarial reserve amount was getting wider and wider from where our actual fund balance was, and so some decisions were made to bring those two closer in line, and you can see that that is working. As of the end of fiscal 23, the fund balance was about 8.2 million, and the actuarial recommended reserve was 7.9. And for this current fiscal year, fiscal 24, it's just under 8.2 million is the recommended actuarial reserve. If we move on to page 19, excuse me. You can see that down there in the bottom right-hand corner, fiscal year to date, we are seeing about a $900,000 increase in claims over the prior year. This has been a consistent trend over the last several years. Costs have been rising, and I do know County Manager Elters did have a question regarding the increase in when you look at the chart on that page, between claims and then claims plus administrative fees. And I'm hopeful, I'm not sure if John, if you are able to address that. We were just curious what is going into that administrative fees portion, because it does look like it has increased at a quicker pace than the actual claim amounts.
Mr. Hatz, if you speak, you have to speak into the microphone.
So looking at, the renewals of all the administrative components of the plan and comparing it to the numbers here, I think we need to probably dive in this a little bit more. The numbers that I am seeing are not showing an overall sharp increase in administrative costs at the rate that is being displayed here. So I think we need to do a little bit of reconciliation.
Where did those numbers come from then?
Chairman Angus, these numbers, I believe, came off of the monthly reports that we receive from the provider.
Okay, so what you're saying is you're going to go back and do a little reconciliation
Yes.
and see if the numbers more align with what Mr. Elters thought should be the numbers?
Yes, we can dig into the details and get that information to the trustees.
Sam, does that answer your question?
Madam Chair, that absolutely does. I just wanted an in-depth, a better understanding of why that is happening, and that will take care of it. While we're on the subject, if I may, just reflecting on what we knew last year, what the recommendation was as far as adjustment to the premiums and the benefits to balance it out. And I know the board has said we wanted to work toward the cash balance being closer to what is required. This is just simply an observation. Looking at the cash balance declining at a fairly sharp rate between March and June of this year, and the closing of the space in the lower chart on the same page, page 18. We should keep this picture in mind as we head toward next year, because we're getting to the point where we want it to get, and we really need to be, in order to sustain the health of the trust going forward, we need to remember these charts when we consider what we do next year.
But there was also a little explanational asterisk to this, because this didn't include the extra insurance. Didn't you say that some of these claims are the full claims, that we didn't get the money back from the?
Chairman Angus, yes, that is correct. There's always a lag between when the claims are paid out, for large claims. If there is a reimbursement due to that stop loss provision, there's a lag between when the claims are paid out and when the stop loss reimbursement shows up.
Will we get an updated picture of this?
It's kind of a rolling window,
Okay.
Chairman.
But this isn't, the point is, this isn't really the final. This is not cast in stone, this number. It fluctuates from the stop loss.
Chairman Angus, that is correct. It does fluctuate. When we do have the annual meeting in March, we should have audited numbers by that point to have solid set in stone numbers for the end of fiscal 23.
Very good. Are there any other questions? Mr. Barlow?
No, thank you.
Okay, how about you, Susie? Or Ms. Duranso?
No
I should say,
question.
something so professional.
Madam Chairman.
You're okay? Okay, I think that's fine. Okay, sounds good.
And then one last piece on here is just the budget for fiscal 24. Those last two pages, page 20 and 21 of your backup, just shows a comparison of the fiscal 23 budget and then the pre-audit budgeted numbers for the year, as well as the adopted budget for fiscal 24. And I would just point out a couple of things. When we look on the revenue side, the health services, the very first line, top of the page, that is the prescription benefit plan reimbursements. And so those actuals do look to be coming in quite a bit above budget, as well as the overall medical insurance reimbursements. So we'll see what the final numbers end up being. And then on the expense side, I'll just note that the revised 23 budget showed that we were going to have a net expense of about 1.4 million, and it's looking like only about 425,000 right now, due to that increase on the revenue side. And then the very last thing at the very bottom of page 21, there was a bit of variance between the financial statement, those are the unaudited numbers for the cash balance, versus what our treasurer is reporting. And that was primarily due to 2 year-end journal entries that had not been booked at the time that this report was run. And so when we get to the final numbers, those two will agree.
Okay, any questions on that? On the phone? Any questions?
No question. No question.
No question.
Thank you.
Madam
Okay.
Chair.
Yes.
May I
Always a
still ask a question?
Yeah.
So really, just to make sure I understand and others understand what Luke is presenting to the board. On the revenue side, you're saying the actual revenues anticipated appear to be above what was budgeted
For fiscal 23, yes, that is correct.
for fiscal '23. Likewise, for expenses, the actual expenses for fiscal '23 in the snapshot of time today appear to be below what was budgeted, which is a good thing as well, correct?
No, that is not correct. So the actual expenditures, our pre-audited numbers on the expense side are also higher, but the net between the increase in revenue and the increased expense, revenue increased more than expense compared to budget. And
So the delta is smaller.
the delta is smaller, correct.
Thank you. Thank you, Madam Chair.
For that clarification. Is there any action on this? Or just a discussion?
Just a report.
Okay, thank you very much, Mr. Mornian.
Thank you, board.
Number 7, discussion, consideration of, and possible action regarding approval of the Walker and Armstrong Certified Public Accountants and Advisors Audit Engagement Letter. Oh, he's back.
Madam Chair and trustees, this is just routine. Every year, the trust gets audited. Last year, Walker and Armstrong was awarded a 3-year contract, so this will be the second year. Each year, as part of the audit procedures, we are required to enter into a formal engagement with the auditor, and so this item is that engagement letter that dictates the terms and the scope of the audit.
Okay. Any questions? I need a motion.
Madam Chair,
Yes.
I move for approval of the requested item as presented.
Very good. Motion and second. All in favor?
Aye.
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 Opposed? Motion carries. Thank you. Number 8, discussion and consideration of and possible action regarding approval of the 2023-2024 MCEBT budget.
Thank you, Madam Chair, trustees. Yeah, attached is the final budget for the county for the 23-24 fiscal year. Broken down in the memo shows, excuse me, all the changes that were implemented. I won't go through all of them, but this itemizes all the lists that were, all the changes that were agreed upon. In addition to the budget overview, breaks down the percent of where your expenses go. Really the only thing that is changing and why this is up for approval is at the time we do that budget, the stop loss reinsurance premiums they're not firm. So there's a number, a placeholder in there. It's usually a pretty good estimate, but now we have that final number, so we just want to bring that to your attention. So the reinsurance rates were reduced by about $190,000 below what was originally estimated. So that is good news. So we have a conservative estimate. The actual final rates came in a little bit lower. So the result of the final budget is about $18,180,000. So which is good. That dollar gets moved, or the savings from the stop loss just gets moved to the general admin line in the budget. So our recommendation is to approve the final 23-24 Mohave Employee Benefits Trust as presented.
Thank you. Any questions or discussion? Sam? Nothing? No questions?
I'm sorry. No question, Madam Chair.
All right, well, thank you. Then I'll need a motion.
Motion to approve the 2023-2024 Mohave County Employee Benefit Trust budget as presented.
Second.
Motion second, all in favor?
Aye.
Aye.
Opposed? Motion carries. Number 9, discussion and consideration of and possible action regarding the 2022 to 2023 incurred but not reported claims reserve.
Thank you, Madam Chair. So every year, Buck Consulting provides an updated, incurred but not reported estimate as the liability for your incurred expenses but not yet paid or reported. This year, their estimate is coming in roughly 4% below the previous year. In the memo, you can see, note the change. That results in about $87,000 or $67,000 overall. Between the components, it's broken down between medical, drug, dental, and peer administration. If there are any questions, I do believe we have Chris Marshall joining us. He's the actuary that puts that information together to address any of the details in this. But as it stands, our recommendation is to approve the 22-23 incurred but not reported as presented.
Sounds good. Okay, any questions? Okay, Verlin.
Maybe a dumb question, but is this just because claims are coming in faster that there's this reduction, or why?
Yeah, yes. Chris could probably provide detail, but typically if you see a change in your reserve that goes down, it means that there is a good chance there's a change in payment patterns, that claims are being paid a little bit faster. Also, a reduction could be that your overall claims liability has gone down as well. So as a reflection of that, that could shrink your needed reserve as well.
Okay. Anyone else?
Madam Chairman, this is
Yes.
Susie. Once this liability is resolved, which means they're all paid, are those going back in the budget for the fiscal year where it came from, or it moves forward to the next fiscal year?
Did you understand that?
No, could you please repeat that question?
Okay, I guess these are liabilities, right? They are claims, but they have not been paid. So once they're resolved and paid, would they move forward to the next fiscal year, or they would be accounted for that fiscal year where they came from?
The liability kind of rolls forward. At the end of the day, you can look back and see what was ultimately incurred in that time period and paid in that time period. But the change in reserve is every fiscal year. It's what your liability is at that point in time. So essentially what the IBNR is telling you is if you were to close the plan as of 6/30/2023, the expenses that come in after 6/30, but were incurred prior to that date, is this estimate. That liability never goes away. The following fiscal year will have a new incurred but not reported liability. So it is kind of a rolling number from year to year that gets updated based on how the size of your population, the utilization of the claims, and the overall cost of the claims.
Did that answer your
thank you.
question?
Yes, yes.
Okay, anything else? Okay. What's the pleasure of the board?
I'll make a motion to approve the 2022-2023 incurred but not reported report as presented.
I second.
Okay, we got a motion and second. All in favor?
Aye.
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 Opposed? Motion carries. Number 10, discussion, consideration of, and possible action regarding the actuary recommended financial reserves.
Thank you. So this is a full component of both components of the needed reserve that includes the IBNR. And Luke mentioned this earlier. The overall recommendation for the minimum reserve is about $8.2 million, and that does include the IBNR as well. And that amount is recommended to be about 6 months of accruals or contributions, if you will, plus the IBNR, and that's the two components that make up the recommendation of the $8.2 million. So our recommendation is to approve the recommended financial reserves as presented.
Okay. Questions?
Madam Chair,
Yes.
I was under the impression that previous years, the last couple of years, at least since I've been back, were that the actuarials recommended about $7 million in reserve. But that was not including the IBNR. It seems now that we're recommending 8.1, but that's inclusive of 1.7 million or so. Are we adjusting our reserve because the risks have changed, or are we adjusting it because what has changed? Or am I just mistaken in thinking that the previous number of $7 million was inclusive, and that's not the case?
That's a very good question, and I'll defer to Chris if he is on the line to get into more detail about his methodology and rationale as respect to the recommendation that he's making.
Chris Marshall?
Yes.
Mr. Marshall, are you
Yes.
on the line?
Yes, I am, Madam Chair. So the reserve last year that we recommended was 7.9 million, and that included the IBNR and contingency. So this year there's been a slight increase up to the 8.2, and that was primarily due to just claims experience increasing over time to account for that increase. So I'm not sure where the 7 million number comes from, but we had 7.9 million last year, and that broke out as 1.8 million for the IBNR and 6.1 for the contingency. It's possible in the year prior, I don't have that up in front of me. I'll look for that, but I remember I think we added something like a additional margin due to COVID at that time, and that might have been why. So I'm going to see if I can find that. And as of 21, it was 7.6 million in total. So I think we did add something for COVID, but it was the year prior to that is when we did it. So.
Just something to add. Sam?
Thank you, Madam Chair. I think that was really helpful. I do vividly remember the discussion about increasing the reserve due to COVID uncertainty. That I remember. Now that he mentions that 7.9 was the number before, and the fact that it's now 8.2 is a reasonable change, given that the increase in claims from the previous year, as reported by our Chief Financial Officer, is $900,000. So it really makes sense. I just wanted to understand that. Thank you.
Okay, thank you. Any other questions? Okay, motion?
Madam Chair,
Yes.
I move to approve the recommended financial reserves as presented.
Second.
Okay, motion second, all in favor?
Aye.
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 Opposed? Motion carries. Number 11, discussion, consideration of, and possible action regarding ratification of the 2023-2024 stop-loss renewal.
Thank you, Madam Chair, trustees. So as I mentioned previously in the budget recommendation, the change was to the stop loss. This is just to move forward with the renewal as previously stated. I just want to point out one small item. Excuse me, the memo does contain a typo. As I mentioned before, in the budget, the estimated savings was roughly about 190,000 based on the stop loss renewal negotiations. The memo states 145,000. I just want to note that it is 190, but the recommendation is to approve the stop loss. But I wanted to bring that to your attention that there's a typo in the memo.
Okay, did everyone get that, or do you need that? Can you repeat that one more time? Where's the typo?
In the fourth paragraph down, the second line from the bottom, you'll see, or the third line says, based on this recommendation, the trust is estimated to save approximately 145,000. That should be 190,000.
Okay. Great. Okay. Yeah. No other questions? Then I need an action.
Madam Chair, so this is more saving than, I move to approve the stop loss renewal as previously bound, with the correction noted of 190,000 saving versus the 145.
Okay, we got motion and second. All in favor?
Aye.
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 Opposed? All right. Number 12, discussion, consideration of, and possible action regarding approval of the 2023-2024 risk management plan.
Great, thank you. So this memo just outlines the risk management plan that we put together every year and itemizes the projects. Not to go through each one, but as you can see, we've identified these following projects for the plan year. One of those were completed for the request for proposal for the Employee Assistance Program. Continued emphasis on wellness with Tori's support and leadership on that. In monitoring to navigate compliance with mental health parity. That is something that we take very seriously, and we review compliance basically monthly. But this is going to be a much more intensive project where we do a full-on compliance review as it relates to any changes with respect to mental health parity. Any monitor administrative financial impacts of COVID, that is all constantly monitoring in our pricing, claims data, in any type of analysis that we're doing. Medical and prescription drug stop loss shopping, if applicable. If we believe the renewal is coming in too higher, we may go out and shop it to see if we can get a better price for covering that risk. And coordination of the trust annual meeting. Those are the projects that we've identified. Our recommendation is to approve the 23-24 risk management plan as presented.
Thank you. Questions? Got a question?
Comment.
Go right ahead.
As to number 2, with the continued emphasis on the wellness program, along with what Chairman Angus has said, there's got to be a way, and I don't know that all the employees of the county watch, or their spouses or family watch the Board of Supervisors meeting. So there's got to be a way to emphasize all of these programs to the employees. I like that the numbers are increasing, but they're not increasing to what they should be, in my opinion.
Is Ken here?
Madam Chair.
Oh, one second, Susie. Can you you okay? Can you tell us what HR does to let the employees know about their options when it comes to wellness?
May I defer to Leanne, since
Oh,
she is
sure.
the one that
Sorry.
sends out the information. Thank you.
Okay.
Hello and thank you. I push this out as much as possible. A lot of it is emails. That's primarily what we have. We do have the whole entire wellness page. During NEO, it's spoken about consistently. I even have it in my signature to check out our wellness page, or look at what screenings are coming up. We have the health fair coming up. I try to get as many of our vendors here as we can. So we do continuously push. It's as much as we can.
NEO being the new employee orientation. And is there a video? Didn't we once talk about doing a video, and the departments individually are aware and push through their employees through departments?
We try to do that, the top-down type of thing, and
Right.
even I'm aware that during management meetings, Ken will bring up these items also for the management team that's there. And then
How are we doing on the like the prostate tests? I mean, we always have a problem getting men to do those kinds of things. Have those numbers gone up?
those we actually, I cannot recall, and I do apologize if it was last year or the year before last, that POP was no longer, given there were no numbers.
Excuse me?
The screenings were no longer done for POP, the
Oh, they're not being done, okay.
Yes, ma'am. My understanding is that though the mammograms, they were completely filled within probably the first week of me putting that information out, and we keep having them extend. So even a lot of our screenings, we're extending times as much as we can to get everybody in that we can.
Right. I think the county's doing a good job in getting it out. I mean, you can't make people to do it, but the whole point in the beginning was, well, people will use it and then they'll talk in the department about how great it is. And I'm hoping that that's kind of how that works in the, going forward.
Chairman, as Leanna says, the wellness fair, we normally get pretty good attendance at the wellness fair. And I know we'll be pushing that because it is a chance to talk with the vendors and the services that are provided.
When is that again?
In November.
Oh.
What is it? November 15th.
November 15th. Very good.
And it's up here in the mezzanine.
Okay. Maybe we can put that into the presentation we do to the board before that date, so we can talk about that and recommend people stop by.
Will do, Madam Chair.
All right. Anyone else? Any questions, comments, discussion? Okay. It's number 12.
Motion?
Yep.
Motion to approve the 2023-2024 risk management plan as presented.
Okay, I need a second.
Second?
All in favor?
Aye.
Aye.
Opposed? Motion carries. 13, administrative update. Do we have any?
Yeah. Great, thank you, Madam Chair. This is the final one, a very quick administrative update. Just a couple things to report on that have already taken place. One is the payment of the PCORI fee. This year that was $4,810, and that was paid prior to the July 31st deadline. Medicare Part D letters have been mailed out as of September 8th, and then the only really to do from this list is we will work with the county staff to finalize dates of the 24-25 annual renewal conference.
Okay.
And no motion with this, it's just an update.
Okay. Any questions? Need an action? Oh, that's just an update. Never mind, no action needed. Request for future action, other than, request that we put up a presentation, including giving more information about wellness to the board of supervisors, hopefully before November 15th.
Madam Chair, we'll see to it that it is on the board agenda for November 6th because October 18th agenda is already set, and that the November 6th would be the, we'll pursue that. As far as a request for future actions, if I may, Madam Chair, we would like to have a discussion with the Mohave County Employee Benefit Trust Board regarding the tri-state EBT. We were just approached with a question or inquiry related to is there any interest from Mohave County to joining that trust? And we just wanted to discuss it with the board here just to make sure we're all on the same page, and we think it would be good to do so in the future.
Do we need further explanation as what that was about, the tri-state EBT? Does everyone understand what that is? Okay.
No, we probably need more information, Madam Chairman.
What did you say, Susie?
We need more information on that.
Oh, Northern Arizona, yeah. Yeah, oh, I'm sorry, Northern, I thought it was Tri-Cities.
It's the three cities and the...
Yeah, it's a trust that Gallagher operates as well. That includes the cities and some school districts. It's a big one, and they have reached out, said, would you consider joining? And there are definitely pros and cons, but it needs to be discussed to this board. That's what we're talking about.
The thinking as we plan ahead and more discussion will take place is to understand more about who they are and what their trust is like, since Gallagher works with them as well as our trust, and then maybe even run some preliminary numbers consistent with what was discussed when we some of us discussed it with you. And this is by no means implying that we're leaning one way or the other. There are pros and cons, as the chair pointed out, but we want the board to be aware of it and to understand those as well.
Yeah, I think it will be interesting to find out and see what others, how we compare to other trusts. So I'm looking forward to that. All right, is there anything else?
Madam Chair.
Oh, sorry.
Oh, okay,
Go
one
ahead.
second. 1 second, Susie.
Okay.
At a future meeting, I would like to know, as far as prescription medications go, I know that our provider has a formulary that they accept or don't accept. But I understand from Walgreens and CVS that from now on, if your insurance, in the very near future, if your insurance does not cover a prescription, they will not fill it. And what are we going to do with people who are on a medication that's not included in the formulary, but they cannot go in and even pay cash for that? I was shocked to hear that from Walgreens, and so I went to CVS and asked the same question, and they said that that's coming down and that's going to be pretty widespread. So just for instance, if I was 65 and my insurance company decided I no longer needed a hormone medication, and my doctor said I did, I can't go in and purchase that hormone prescription. So that, whether that's a pain medication or whatever it is that's not covered in our plan, how are they going to live?
So obvious what they want the end game to be. That's just, I never heard that. Thank you for bringing that up. Do you know about this?
Not to that extent, but just a little bit of background on why things like that happen. Typically, every 6 months, there's an update to the formulary, and every now and again, drugs come on and then others may fall off. So if somebody is currently taking a medication that falls off of the formulary, it will be no longer covered at that level. However, there are therapeutic equivalent alternatives provided. So how the PBM manages that, we should definitely get an update on what they do administratively to make sure the member is aware of any changes that are going to take place, and the amount of notification that they get, and is there a lag time or a grandfathered in the contract that they can maintain that prescription drug before any change is made. And if they can't make a change or their doctor determines they cannot make a change, what is the process to maintain that drug at the current coverage levels? So all of those things would need to be addressed by the PBM, how that gets administered, and the steps to make sure that there's no disruption in care to the member in maintaining their prescription that provides either the same prescription or an equal therapeutic value.
Okay, so when is our next meeting? It's not till March? Is that, so did they give you any idea when they thought this was going to start? It's just, be aware, it's down the road. All right, so can we have an in-depth presentation about, hopefully, maybe we'll all know more by then about what they're up to?
Yeah, absolutely. We'll have a very detailed pharmacy presentation at that time.
Very good. Okay, Ms. Duranzo, did you have a question or item you want on?
Yes, Madam Chairman. I need to go back to the issue that our county manager mentioned about the Tri-County. What is that really? Are we supposed to join them? And what is this all about, Sam?
Madam Chair,
Hello?
Susie,
Okay.
Mr. Ranso, we were contacted by one of the members, one of the cities, to say, hey, is there any interest in joining the trust? That was really about the extent. We did do some follow-up, which we believe it's the prudent thing to do. We, understanding that Gallagher supports them and services them as they do with our trust. We had discussion with Gallagher, had our chief financial officer and HR director in on the discussion, briefed the chair, Supervisor Angus, and we thought, without, I don't really want to prejudge. We have thoughts and concerns, and there's pros and cons. So there is really truly no I'll go as far as saying we would we see some issues in thinking in that direction, but we did not want to make a decision on behalf of this board without your input and you saying, oh yeah, we see the points and we see the ups and downs and we agree with whatever the conclusion is. We wanted, our chair, Supervisor Angus, wanted to make sure that all of us on the board had the same information, not just a couple of us.
Right, and just to kind of wrap it up, the county was approached, and there are definitely pros and cons. We've known, we knew about this trust for many, many years, to the point where many years ago, we talked about the possibility of joining, and it just wasn't a right fit at that time. Lots of consideration. There's just a lot to go over. So I thought it was important. We thought it was important to, let everybody hear it and see what your ideas are. Maybe you think it was good, but this is would be a long process. So this presentation in our next meeting would just be the beginning. But we just thought it was important for this whole board to understand since we were approached.
Okay. Will there be any presentation in the next meeting in March then? Or that would be it would be in a different time?
I don't think that it's urgent. I don't think there's a time
Yeah,
or anything.
Madam Chair, Mr. Ranso, the thinking was at the next time this board meet, we don't really see a need to do a special board meeting. This is really, please understand, this is for information only. We're not undertaking any steps in any particular direction, but we want to be completely transparent, and then this board as a whole should be aware and concludes whatever is concluded. So there's no urgency, and we think bringing this item back as a future item in March when we meet is soon enough.
Okay, thank you.
Okay. Anything else? Okay, with that, there's nothing else, then this meeting's adjourned. Thank you to the Board of Trustees again for your time and your great insight into this trust. Thank you.
Thank you. Bye.
Yeah.